headrest.
It's long.
Thank you. We have two different holders that hold this piece on. This is one. The other one fits right onto the bed in these holes down here and goes flat flush. This one side moves. You line it up. The little rails. Alright. And it's always difficult. It'll be just right so it fits on the rails. Tighten it down. You need to try to have it far enough in so you don't have to worry about it coming off. Take the base, put it in the hole. It's best to have it lined up with the head of the bed right here. That's how you can tell how far to push it in. Now, if you're using the horseshoe, it fits directly on the starburst, like that. So you screw this on, and it's mainly just a matching up the starburst size. So sometimes Dr. Kelly wants the horseshoe to have a little bit more elongation, so he'll put the adapter. That's all this is changes the starburst size. So it can be like this. And one thing when you're putting a patient on it or moving it, you always want to start at the top, tighten this, and then do the lever. And then when you're removing it, you undo the lever and then loosen it from the top and let it lay. So if for some reason you wanted to have a little bit more room to play with the horseshoe, extender on. Can you see? You sleeping? Just loosen it so it's wiggly. This can fit on here. That gives you, sometimes Dr. Kelly likes to have a little bit more leeway. If you're using the clamps, pins, put the pins in here. Every time you use this, since it has a large starburst, you do have to use the adapter. So you always have to make sure you have this little adapter so this will match up with it. The patient will be in this before you attach it to the bed. So patient goes to sleep on, if they're prone, they go to sleep on a stretcher. One person holds the head, and then they fix where it goes. If they're supine, he'll put them in the clamp. Bring this up. And someone will be holding the head. Put that where they want it. You'll be getting thorough directions from the surgeon. Tighten this one, tighten this one, and then do the clamp. There is some adjustments you can make on this clamp, but they're all set the way they should be. You shouldn't be tightening the clamp. That really messes things up when somebody does that. And then if you were taking them out, you loosen the bottom. Loosen that. And then take that out. So people get You just have to remember that this is just simply changes the starburst from big to little. So just remember, if you have this, you have to have this. The apparatus on each bed, the head holder, is a small starburst. And then we have one bed, Skytron, that has also the capability of using the Mayfield, but as you see, these are very small. So if you have a bed with little tiny holes right here, then you know you need this. This will not work on this one. It's too small. The most important thing is make sure all the little nuts are tight. This is the little adjuster for the Mayfield. Just try not to turn that. It's just perfect the way it is. Anytime that you're doing operations on the brain where you don't want the head to move, they'll be in pins. About 4 years old is the cutoff, so you don't want to put anyone younger than that in pins. And then Chiari's on the cervical. You don't want it to move, they go in pins. Everything else pretty much horseshoe.
And we have the small horseshoe.
And we have a large and a small horseshoe, many of them. Are there any questions or any problems anyone's had with putting this on?
Yeah, we just have to make sure that those little horseshoe pads are in position and not broken off, because mine fell off one side and bounced off of Dr. Harshberger's foot.
Yes.
Rolled off. And then
So-
we put it back on, and then if the other one rolled off and hit him in the other foot. And then he just looked at it
So-
rolling away, and he's like, that's the problem.
These are not glued to this. All of them look like this.
Yeah, it was like.
So to put these on, this one is not broken, but where they usually break is right here.
Yeah.
You slide the end on first, and then you clip the little clip over the edge. Very important. Also, you just wipe these with a cloth in the room, a wipe. They don't go down through the washer. Taking it off, you just release the little clamp on the side and pull it off like that. The ones that are cracked, you know, when the horseshoe in this position, it will stay on, but it's not the ultimate. There's some people that like to wrap them in web roll. They don't recommend that. These are made to be right on the skin or on the face. The other thing is when you have a patient that's prone, there have been pressure ulcers on their cheeks. You just have to make sure that their face is inside like that. And it's not applying too much pressure. You can put, if you have to, you can put extra padding, but they should be very cognizant of how they put the face in this. A lot of times they want to tip it, and it's just too much pressure on the cheeks. You want to make sure that their eyes are not laying on it. They should be able to see through it. What else? Anything else, Reese?
So when they clean it, like after a case, they should remove
Take
the
the
gel
pads off,
and leave it in the room.
Wipe them. The whole
Center.
thing can be wiped down unless it's seriously bloody. Then you can have them wash it. But
Not the gel, just the.
everything. No, it can be washed in decontamination.
Okay.
Right?
Wiping in the room takes too long.
It's a time
Some of them
problem.
are really
Takes too much
bloody.
time to try to wipe it in.
How many of those do we have?
We have, no, we have many more. We probably have
One each.
4 of these. Actually, there's 2 new ones. There's probably 5 of these. 5 of these. And the other thing is we have 2 new bases and clamps. And the bases that are a darker gray that are new, they will not fit in the, there's another piece like this that fits this bed that goes flush. They won't fit through the holes. So they're supposed to be universal, but they're not. It's so you have to use this bracket. And then, to get this bracket off, there's a little lever right here on the end. You just have to hold it down. It's kind of made to keep them on the bed. Yeah. But again, just worry about the weight. You don't want, if you don't have the foot on there, and then this extends their head out to here, if they're very, very heavy, the bed can tip.
How heavy?
Like 500 pounds, 400 pounds.
Should that be put on a headpiece, or should you really put it on the actual bed part?
Cannot go on the headpiece, ever. Can't be movable.
It won't go in.
Good.
Well, you can use this on the bed while the headpiece is on it, but it's not gonna work very well.
Would you just put it on the other end, the Mayfield, if you had a really heavy person?
Anytime you use the Mayfield, you're going to put it on this end because they're gonna be working up here and they need footwear for
So
pillows.
somebody who's 500 pounds should hopefully never need
Just put
the
the
roll
headpiece on
straight.
the other side.
No brain surgery. But seriously, something falls, like a leg.
Yeah, I know.
I've never seen a leg.
Do we put a roll stool in the pool?
Yeah, I've never seen one.
Not here, but I've seen it before.
But it's, becomes quite apparent if the bed is teetering.
Yes, Pam?
I was gonna say that also with that, Angela, if you were going through that, is that they have to make sure they match the skull pin with the patient, because we have
Yes.
two different sizes.
Very
skull
good.
pins.
There's
There's adult.
child and adult skull pins. Adult starts, you know, it can start pretty early because the heads get pretty big pretty quick. So even a 10-year-old, if they're a big 10-year-old, we use the adult. You can always ask. You always put ointment on the actual end of the pins, and that is to prevent an embolism, air embolism. It does go straight into the skull. Anything to add, Larry? No?
John,